Assalamualaikum and very good morning to our valuable lecturer, Sir Zulkifli Ismail. My name is Muhammad Shafiqah bin Osman. My metric number is 2020871702.
My name is Muhammad Ati Ikrim bin Muhammad Yusri. My metric number is 2020830766.
Hi, Assalamualaikum. My name is Siti Masyarah binti Ahmad. My metric number is 2020813172.
Assalamualaikum everyone. I'm Nurzawana binti Muhammad Ali from SR 2452E and my metric number is 2020850196.
Assalamualaikum and hello. My name is Norahma Lafika Zafira binti Jamaluddin. My metric number is 2020822232.
Today, we are going to talk about exercise and specific population, which is obese. In this video, we would like to talk about definition and characteristics of obese, who should practice the exercise, advantage and disadvantage of the exercise, how is the exercise being practiced, conclusion and also our references for this video. Obesity is a medical condition involving an abnormal or excessive fat accumulation that presents a negative effect on health. Obesity is defined as having a body mass index BMI of 30 kg per square meter or more. The range 25 to 30 kg per square meter is defined as overweight. A body mass index is a measurement obtained by dividing a person's weight by the square of the person's height. Obesity is further evaluated in terms of fat distribution around the waist. Men with a waist measurement of 94 cm or more and women with a waist measurement of 80 cm or more are more likely to develop obesity-related health problems. Obesity is a chronic medical condition that increases your risk of disease and health problems, particularly certain types of cancer like cardiovascular diseases, type 2 diabetes, osteoarthritis, infertility, irregular periods, non-alcoholic fatty liver, and also obstructive sleep apnea. Obesity can also affect your quality of life and lead to psychological problems such as depression, low self-esteem, shame, guilt, and social isolation. Obesity is caused by eating more calories than you burn through exercise and normal daily activities. As a result, your body stores these excess calories as fat. First one is inactivity. You having a sedentary lifestyle. Second, unhealthy eating, which means you have a poor diet of foods high in calories. And the third one is lack of sleep. This can lead you to have abnormal changes that can increase your appetite. You may also crave foods in calories, which can contribute to weight gain. And the next one is genetics. Genetics also can play a role in how your body converts food into energy and how your body burns calories during exercise. The other one is pregnancy, because sometimes weight gain during pregnancy may be hard to lose, which will eventually leading to obesity. The next one is aging, which can lead to decrease in the amount of muscle in your body. This decreased muscle mass leading to slower metabolic rate, making it easier to gain weight. Last but not least is certain medication. Certain medication may cause weight gain or changes in the body composition, such as insulin, antidepressant, steroids, and some form of hormonal contraception. And lastly is obesity can sometimes be caused by some certain medical conditions such as polycystic ovary syndrome, Prader-Willi syndrome, Cushing syndrome, and hypothyroidism. The symptom of obesity is having a BMI of 30 or more. Obesity can be categorized as obese class 1 with BMI of 30, obese class 2 with BMI of 35 to 39.9, And lastly, obese class 3 with BMI of 40 and higher.
Now, I want to talk about who should practice the exercise. There are two types of individuals that need to do the exercise. First, individual that overweight. Overweight caused by more of calories intake rather than physical activity in somebody's lifestyle. The calorie will convert into fat when the individual did not expend the calorie by doing any physical activity. Physical activity can increase people's total energy expenditure, which can help them stay in energy balance or even lose weight, as long as they do not eat more to compensate for the extra calories they burn. Furthermore, physical activity are the most effective, safe, and healthier way to decrease body fat rather than other methods such as fat reduction treatment. Fat reduction treatment is a treatment to remove fat in the body by surgery. This method can only remove the fat but cannot give a healthy life to the people. That's why people that overweight need to do more physical activities. Second, individuals that had unhealthy lifestyle. Mostly people nowadays are likely to do indoors activity and stay in unhealthy lifestyle. Indoor activities such as playing video games, watching television, spend time in social media, and many more. Also included junk foods that is an unhealthy food to our life, such as bicarbonate drinks, snacks, and instant food. These people must do more exercise and keep practice it into our lifestyle to get healthy, because exercise can help to promote weight loss, but it seems to work best when combined with a lower calorie eating plan and stop taking junk foods. However, they likely need to exercise for long periods of time or at high intensity to lose weight and stay healthy.
What are the advantages and disadvantages for exercise and specific population in obese? Increase the amount of energy expenditure. Physical activity will increase people's total energy expenditure, which is it can help them to stay in energy balance or even lose weight if they don't eat more to compensate for the extra calories they burn. Reduce your risk of heart diseases. Exercise strengthens your heart and improves your circulation. The increased blood flow will reduce the oxygen levels in your body, and this will help lower your risk of heart diseases such as cholesterol, coronary artery diseases, and heart attack. For the third one is manage blood sugar and insulin levels. Exercise can lower your blood sugar level and help your insulin work better, and this can cut down your risk of metabolic syndrome and type 2 diabetes. Next, strengthen your bones and muscles. Regular exercise can help build strong bones, and it also can slow the loss of bone density that comes with age. Doing muscle strengthening activities can help you increase or maintain your muscle mass or strength. And the last one is improve your mental health and mood. During exercise, your body will release chemicals that can improve your mood and make you feel more relaxed. And this can help you deal with stress and reduce your risk of depression. For the disadvantage is cardiac problems. Obese people often have cardiac issues such as high blood pressure and heart diseases. Vigorous exercise usually triggers a temporary spike in blood pressure. True, which is it can be dangerous for obese people with cardiac problems. Respiratory problems. Obese people often feel short of breath even they use small amount of physical exertion. This is because the chest wall is heavier than the normal in obese people, which is it can be difficult for the lungs to fully expand and stop exercising if you begin to have difficulty breathing. Injury to the joints. Jogging puts significant stress on the joints, including the knees, and recommend for obese people to avoid such high impact exercise because it carrying extra weight already puts a significant amount of stress on the joints even without indulging in high impact activities. If exhaustion. This is because obese people have more difficulty regulating their body temperature than non-obese people, which is it can make them more susceptible to heat exhaustion. And the last one is dehydration. Since obese people have more trouble regulating their body temperature, and since they may sweat more than non-obese people, they are more susceptible to dehydration when they exercising vigorously, especially in hot temperature.
There are several exercises for obese people. According to the American Heart Association, any kind of physical activity counts as exercise as long as you're moving your body and burning calories. The first exercise is walking. While the American Heart Association mentions activities like climbing stairs and jogging, one of the easiest and most effective ways to ease into a healthier lifestyle is to begin walking. Not only it is free, it is a low impact exercise that you can do nearly anywhere, inside or out. For morbidly obese people, walking may be difficult, but it's doable with assistance. Even walking slowly will burn additional calories when you're carrying extra weight because you're exerting more energy to move your body. Secondly, water aerobic. Exercising in the water can have multiple benefits. Water helps to support your body weight, which makes you feel lighter. It also reduces the impact on your joints, which means that the pain you might feel in your hips or knees from moving on land is virtually non-existent when you stand in the water. And the last one is stationary bike. The seated stationary bike, also known as a recumbent bike, has a backrest that makes it a good choice for obese people. Some obese people lack a strong abdominal core, which makes it difficult to sit on an upright stationary bike. Seated bikes are also less stressful on the lower spine, which is a common complaint for people carrying extra weight. Overweight and obese people can partake in the same exercise prescription as individuals with normal weight. However, special consideration must be made, such as current comorbidities that may be associated with obesity, like orthopedic risk, pulmonary, and cardiac comorbidities. However, this should not deter individuals away from participating in exercise programs, as exercise is extremely important for overall health. Patients must be cleared by their healthcare provider for any comorbid conditions by history and physical examination to maximize patient safety. How's the exercise being practiced? First things first, the recommendation for inactive individuals is start low and go slow by starting with lower intensity activities and gradually increasing frequency and duration of the activity. Number 2, it is a good idea to spread out aerobic activity over the week versus all the time in one day. And the third step is utilize appropriate gear and sports equipment and choose safe environments. The fourth step is adjust exercises as necessary to decrease orthopedic risk or is non-ambulatory, if applicable. This can include cycling instead of running if an individual has arthritis, if individuals are not ambulatory or may have to modify exercise due to special circumstances, the exercise guidelines still apply. However, the patient can get creative to find ways to achieve them, such as utilizing limbs that are more ambulatory than others, such as moving arms faster in order to get heart rate up if legs are not able to use, upper body ergometer, and etc. Lastly, anaerobic training can be implemented and may even increase muscle mass. Anaerobic exercise has not been shown to be effective in altering energy expenditure or absolute weight loss. However, if the goal of the patient is to increase muscle mass, then anaerobic exercise is highly encouraged. Furthermore, in order to increase muscle mass, each muscle group should be exercised at a minimum of 10 sets per week, with one set consisting of 8 to 10 reps. Also, ensure proper form to avoid injuries. Individuals who are not ambulatory or may have limited movement are still able to participate in an anaerobic exercise. Individuals must ensure proper form but can modify exercises as needed, such as upper body only exercises, lower body only exercises, using a neutral grip, keeping stable movements, etc.
In conclusions, exercise play an important role in the weight loss process. Exercise can change body composition, reduce the risk of getting disease, and improve our quality of life. Before an obese patient begin some exercise program, they should get an examination from a doctor to determine the appropriate level of exercise based on age, risk of disease, and the result of the physical examination. It is very important to emphasize that all exercise programs are started gradually. Moderate exercise for 30 minutes every day can be practiced, reducing the risk of getting disease such as heart disease and diabetes. To maintain weight after the onset of weight loss, require moderate exercise for 60 to 90 minutes per day. Besides that, they should take a healthy diet. For example, eat by following the food pyramid, cut amount of the sugar intake, avoid eating heavy food before going to sleep.
These are the references for this video. I hope you guys enjoy and understand what we are trying to share with you guys today. So that's all from us. Thank you. Assalamualaikum and have a nice day.